good morning. I want to welcome you to our Friday press briefing with updates on COVID-19. Please join me in a moment of silence for the lives we've lost due to COVID-19 and for the families they leave behind. Thank you. Before we begin today, I will mention to you that we will be moving to weekly press conferences beginning next week. Same place, same time, 10 a.m. on Friday. Weekly press conferences beginning next week. We'll begin now with our updates from our community leaders, and first we'll hear from City of Albany Mayor Bo Durham. Mr. Mayor.
Thank you, Chief. 4,071 Americans died of COVID on January 7th. This was a new record and the first time that more than 4,000 Americans had died in one day. I will not remember that number, though I will always remember that date, as my father was one of those who lost his life. My father, last Thursday morning, was moaning, gasping for air. The hospice nurse referred to it as agonal breathing and told my brother and I that the end would be near. I'm thankful that I had the opportunity to be with him when he passed. I want to express my gratitude to the employees of the home where my father lived and to all healthcare workers who are constantly at risk. I think of, thank, and fear for the ladies who continued to bring my father medicine and food, even though they knew he had this deadly virus. All of us need to remember the courageous men and women who every day knowingly expose themselves to this contagion to protect and preserve the lives of others. In the beginning, we knew very little about the virus. Today, many of us choose to ignore the advice, which would require even minimal modification of our behavior and activities. I recently mentioned that my addresses seem to be little more than preaching to the choir, as many citizens scoff at our mask ordinance. Young people continue to congregate at bars, and people of all ages traveled over the holidays to spend time with friends and loved ones, even though they had seen the surge in the number of infections following July 4th and Thanksgiving. We all know that the number of people who have been infected has steadily risen since shortly after Thanksgiving. Hospitalizations are up, and we know this will be followed by increased deaths. Unfortunately, the American people were warned to avoid gatherings over the holidays. Many of us, for whatever reason, ignored admonitions of healthcare experts and responsible civic leaders, just as millions of Americans refused to wear a mask in disregard of studies which confirm this is the most effective way of preventing the spread of the virus. The fact is, far too many of us are too selfish, too narrow-minded, too insensitive to protect others if they are in any way inconvenienced. Millions of Americans continue to gather in nightclubs where few patrons are wearing masks and virtually no one maintains social distance. The most wretched acts of irresponsibility were those political rallies where hundreds and even thousands of Americans, few wearing masks, cheered as speakers ridiculed those who have advocated for safety precautions. My father had resided in an assisted living facility for several years. I have seen firsthand how difficult these past 10 months have been for the hundreds of thousands of Americans living in retirement homes and the 1.4 million Americans living in nursing homes. My father could not have guessed in his apartment could not leave the premises except for doctor's appointments, and had very limited interaction with the other residents, as they were not allowed to eat in the dining hall. I'm upset, I'm disappointed, I'm angry, but most of all, I'm grieving. My father was, for most of the last year of his life, isolated in his apartment. Because of the lockdown, he was unable to attend worship services at the church where he was baptized 75 years ago. He could not celebrate Thanksgiving or Christmas with his family. The loneliness led to despair. And in the last few months, my father spoke of not wanting to be a burden. COVID broke my father's spirit before it took his life. The city honored the families of the 3 employees who lost their lives to the virus during the virtual Christmas parade. I was reminded when presenting plaques to the widows and children of these employees that each person who dies is more than a number. They, like the 3 employees who were recognized, are forever lost to their loved ones. They will not be present for holidays, the weddings of their children, and their grandchildren will know them only through the words of those left behind. I now have a much better understanding of their ongoing grief, their loss, and I would like to let these 3 families know they are in my thoughts and prayers. My father could have been inoculated had the vaccine been available only a few weeks earlier. This pandemic has claimed the lives of 390,000 Americans. Experts tell us the next 3 weeks will be the worst yet, with as many as 90,000 more deaths. This will not be avoided. We can, however, drastically reduce the number of deaths in the months to follow by being vaccinated. I encourage everyone to be vaccinated so that you and your loved ones do not have to mourn the loss of a family member. Thank you.
Mr. Mayor, thank you for sharing personally with us this morning, and please accept our condolences. I'd like to bring up now for some comments the Dougherty County Commission Chair, Christopher Cohilas.
Thank you, Chief, Mayor. Our heartfelt condolences to you and your family. Another example of one of the far too many tragedies that we continue to endure as we continue to try and find light at the end of the tunnel. I'm going to be very blunt, be very direct. We are in a complicated time at a time that we have light at the end of the tunnel. We have a tremendous resource in vaccines being here in this community. At the same time that we have a tremendous amount of infection in this community, in this state, and in this country. The data is very clear. We're hovering at about 17.5% to 18% of an infection rate, which is a very high rate for this community. The number of deaths has gone up. It is not where it was in March, April, and May, but it is going up. We are seeing people that are becoming infected in long-term care facilities, nursing homes, fine gentlemen and women just like the mayor's father that are experiencing this. And at the same time, another train has left the station, and that train is the vaccine. And while it's not going to fix everything, It is important to understand. It's important to grasp onto hope. It's important also to receive important, truthful, and medically based information about the vaccines. And I will say this: I've stood here at this podium for several years, whether it's been through tornadoes, hurricanes, hurricane force straight line winds, you name the disaster, and now COVID-19. And I'm going to say this: do not get your information from social media. Do not get your information from somebody that just posts something or shares something and that did not go to medical school. That is, frankly, it's not smart, and it is a way that bad information gets shared. I'm going to share the information that I have that's been made available to me regarding the vaccines. We are very fortunate in this community to have access to vaccines. We have a tremendous amount of vaccine that has been able to be stored here in this community that, frankly, many other communities can't. We have two different types of vaccines in this community. That is the Moderna vaccine as well as the Pfizer vaccine. Both of these are what are called two-shot vaccines, meaning that you have to take one shot and then you have to take a second, like a booster shot. With the Moderna vaccine, you would wait 28 days before you receive your second injection. With the Pfizer vaccine, you wait 21 days. Both vaccines are reported to be approximately 95% effective, and the primary difference in the two is the way that they are stored. The Moderna one Moderna being able to be refrigerated as other vaccines, and Pfizer requires an extremely cold storage facility. And again, I want to say to our partners at Phoebe, thank you for making the investments necessary to be able to store all of these different types of vaccines for the benefit of our community. This is the primary reason why not all facilities can carry the Pfizer vaccine. They simply do not have adequate storage in a climate climate that is required. Both vaccines have reported potentially side effects. The most common side effects, which usually occur at the second dosage, include fever, achiness, and fatigue, but these usually subside within 24 to 48 hours of the injection time. Let me say this. Right now at Phoebe HealthWorks, we are vaccinating approximately 650 people a day. Every single day, an EMT from Daugherty County EMS goes there, works a full day, and his or her job every single day is just to be there to respond in case there is some sort of catastrophic allergic reaction, some sort of emergency situation by virtue of someone receiving the vaccine. Do you know how many times they've had to do that work? Zero. Zero. Now, it's not me making a testimonial for the vaccine. I'm just sharing with you the information that I have from our professionals. Right now, we are vaccinating a very large number of people. We're getting the folks that are over 65. We're getting the healthcare workers. We're getting the firefighters, the law enforcement, the first responders. We're getting those people in the door and getting them vaccinated, and that's very important. And it's important that we get everybody within every group vaccinated as quickly as possible so that we can truly turn the tide on this pandemic. And it's important for you to understand real and honest information about the vaccine. The vaccine, either one, it doesn't mean that you can now not wear a mask, because the way that this virus works, as I understand it from talking to the medical professionals, is this. You can still, you can be vaccinated. You go for your first vaccine, you go for your second vaccine. But you can still draw in the germs that can live within you, inside your nasal passage and what have you, and so that you can actually retransmit the virus even though you aren't suffering from And so, in other words, you can still spread it. And so it's very important that everyone continue to wear masks when social distancing is not, you're not capable of doing it. Now, more than ever, when we have light at the end of the tunnel, we shouldn't let our guard down. And I'm reminded of I'm a big sports imagery person, but it's literally, it would be like someone who has run a world record marathon, and in the last mile, they decide to stop and walk. And we need to continue doing and working and being disciplined so that we can get towards the end of this marathon, so that we can get the help that we need, so that we can take care of all of the resources and all of the people that need the resources here in this community. We've been standing here for months. I mean, I remember standing here when I frankly thought the possibility of a vaccine in any reasonable period of time was far-fetched, and now it's here. So let's take full advantage of that as a community. Let's be smart. Let's do the right things. Let's mask up, clean up, and we're also at a time where we're post-holidays. Like, this is a mathematical problem. The more people that are infected means the more people that can infect you. The more people that are infected means the more people die. The more people that die means more funerals, means more families that are affected, means more children that are without parents, more families that are without grandparents, more church members that are gone, more employees that are lost. And when you take someone's life away, you take away everything that they've ever done. And it's gone. You take away all of the birthdays. You take away all of the future memories. And so let's pause for a second and really catch our breath. Be diligent. Pass quality information. Get quality information about the vaccines. And especially for those in the over 65 category, please, we have multiple ways to get the vaccine, whether through the Department of Public Health or through Phoebe. It is of paramount importance, and everyone makes their own medical decision. And I'm not an advocate for any one particular vaccine or whatever, but I'm sharing with you the information that I have, and that it is 95% effective, and that from our own local folks, not one single person has reported a spontaneous allergic reaction. I'm not a medical doctor, but I know common sense. And that's good for our community in this marathon. Thank you.
Thank you, Mr. Chairman, for your remarks today. We will now hear from our representative from Phoebe Putnam Memorial Hospital. Dr. James Black is with us. He is the chairman of the emergency department. Dr. Black.
I'm going to continue to try to do my due diligence. Good morning. Where to start? I guess our chart's up. We'll start talking about the COVID-19 numbers. As you can see on our chart, on our orange and blue chart, you see the sharp incline to the right that shows that we're in the middle of a continuing and significant surge. As of this morning, throughout the health system, we're taking care of nearly 130 patients. At this pace, it remains probable and actually likely that we're going to exceed the numbers that we have had even over March and April. Over the past several days, in spite of having new treatments and all that we've learned, 17 people have died in our system. At this pace, if we continue, January will be the deadliest month, even worse than March and April. even worse than March and April. It's imperative that we do everything that we can. We have to remember those three simple W's. Wear a mask, watch your distance, and wash your hands. I also want to bring up a couple of things. We're having conversations with a couple of my partners and I. Think about how many of you have had smallpox? How many of you have had polio? How many of you have had diphtheria? I've actually seen a case of diphtheria. I saw it back in 1991 while I was in medical school in Columbus, Ohio. How about rubella? How about measles? How about mumps? These diseases have all but been eradicated in the U.S. and in the case of smallpox, worldwide. If you throw in things like hepatitis A and B, Haemophilus influenza, rotavirus, chickenpox, there are several diseases that we've been able to get control of and almost eliminate by mass vaccination. Again, I'm encouraging everyone to do your due diligence, get as much information as you can from credible sources, but after that, give some strong consideration to getting the vaccine. I told you I would keep you guys posted. I had my first vaccination 4 weeks ago yesterday, and the second shot a week ago yesterday. I'm still upright. I had some shoulder soreness, and then everybody I've talked to, we have not had any significant response, adverse response to vaccination. Some people have had some mild symptoms and even some moderate symptoms that have gone away within a day or two. I want to impress upon you, even these mild symptoms that you're having are actually an indication that your body is working and mounting an immune response. So it's to be expected that some people may have and may exhibit some symptoms. The vaccinations are going exceedingly well. And I think the mayor said we were averaging 600 or so a day. Yesterday we did 1,100 vaccinations. And over the last 3 days, we've done more vaccinations than we've done in the past 3.5 weeks. So as we get the process down, which has gone exceedingly smooth, but that's an effort, that's in large part to the large amount of planning and also the cooperation that we've had between community health and our other community partners, and able to schedule and get the vaccination distributed. My mother has had her vaccination, and she said the process was smooth. She said she came prepared for it to be an extended process, but she was in and out, in her words, in no time at all. That number for you to call, and I'll try to keep remembering, reminding, is 229-312-1919 to call and get that scheduled. Right now, we're only able to vaccinate our healthcare workers, first responders, and individuals that are 65 years or older. But again, as that vaccination and as that group expands, we will get the information out and we will make the vaccine available to all those that are eligible, as long as we have supply of it. A couple of the numbers. I had the opportunity, I guess the pleasure, of taking care of a World War II veteran, and we actually have a few of them in the Albany area. And the gentleman, now they're in short supply, believe me, but the gentleman was very knowledgeable, and our conversation started centering around Pearl Harbor. And as we begin to talk, I began to think. 2,355 service members, and a total of 2,404, I believe, is the number of people died in the Pearl Harbor attacks. Very few people are around to remember that. We made more recent history. We had the attacks on the World Trade Center and other sites on September 11th, 2001. 2,977 Americans and 19 terrorists died, bringing a total of 2,996. You may, for some of you that are still younger, you may remember a couple of years ago we had Boeing 737 Maxes, two of them that crashed within a few months of each other, grounding the entire fleet. 346 people died in those two plane crashes, and we grounded the fleet for nearly 2 years. They recently were just allowed to restart flights. Every day, we're losing more people than we lost at Pearl Harbor due to coronavirus. Every day, we're losing more people that lost their lives during the September 11 attacks. Every day, we're losing the equivalent of 10 to 12 airplanes crashing every single day. We must take this seriously. People are still getting sick. People are still dying. Tuesday, 4,327 people died. That is the highest number we've had in a single day. Over the past week, we've averaged 3,300 deaths. That is the highest weekly number that we've had since we had our first case of coronavirus. The numbers are continuing to go up. There are over 131,300 people who are hospitalized in this country right now because of coronavirus. 131,000 people in the hospital because of coronavirus. There are several times that many people at home who are not sick enough yet to be in the hospital with coronavirus. This is still very real. This is still very pertinent. This is the #1 killer of people. It is incumbent upon us to do everything that we can to reduce the spread and transmission of this disease. Thank you for your time.
Thank you, Dr. Black, for your comments today. We will now hear from the Director of the Southwest Georgia District Department of Public Health, Dr. Charles Lewis.
Good morning. In order to reach herd immunity in this country, we probably need to vaccinate somewhere in the neighborhood of 200 million people. And bear in mind that in most of these cases, that's going to be 2 vaccinations. So we're really looking at about 400 million vaccinations over the next 6 months. That's never been done before in this country or anywhere else that I know of. We have had mass vaccinations before. When we had polio and we tried to vaccinate the entire nation, that was oral. It was a lot quicker. It's a lot easier. I know because I was there. But actually doing injectable vaccines is a lot more time consuming. There's a lot more paperwork to do. And we are new into this process. We're learning more and more every day. We're getting better at streamlining the process. We're trying to hire more people to help us. We're engaged in partnerships so that we can pool our resources. In fact, the project here that Phoebe is doing, we are sending 2 of our Daugherty County public health nurses over to Phoebe 2 days a week to help out with that. I have visited there yesterday, and it's going very well. So everyone, rightfully so, wants to know why we can't be quicker at this. And we are we're working long hours, vaccinating as many people as we can each day. We're getting better at it. The numbers are climbing. In the 14 county district, we've done somewhere around 4,000 vaccines. In Daugherty County, Public Health has done around 700 vaccines, and every day it's going to be higher and higher. And we want this to be done quickly, just as much as everyone else. We appreciate everyone's patience and your understanding, but we're right there with you. So every county in Southwest Georgia in public health is administering the COVID-19 vaccine. Currently, we don't have an online option to schedule an appointment, and all of the vaccines are being done by appointments. We're currently not taking walk-ins for the vaccines, and there's a variety of reasons for that. So currently, the best way to get a vaccine through public health in Southwest Georgia is to simply call your health department. Some health departments are making all of their own appointments. Some are making appointments on their own, but they're also using a central call center. So it's best just to call your county health department. If they are able to make your appointment, they will do that at the health department. If they're tied up and they can't work with you at that time, in most cases you'll have an option to choose a number and be transferred to the call center where someone can make your appointment. So if you don't get through the first time, please keep calling. We will schedule an appointment for you. I want to say a word about testing. We're excited to announce that in Daugherty County, there will be a new option for getting tested for COVID-19. For several months now, we have been providing the collections for testing at the Forestry Commission site on the south end of Slappy. We've done some at the Health Department as well. In fact, we're at the Health Department now doing those. But starting next Friday, January the 22nd, a new partnership will begin here in Daugherty County. There's a company called Mako, and some of you are able to see the information on the screen now. Mako originally was a testing laboratory for COVID-19. They also offer a service where they will go into a community and bring all of the labor in to collect the specimens. They will deliver them to the laboratory, perform the tests, and then make the results available. So we have a partnership between the Daugherty County Exchange Club Fair and Mako and Public Health. Starting next Friday, this service will be offered 6 days a week, 9 to 4 Monday through Friday and 9 to 1 on Saturdays. It starts next Friday, January the 22nd. To pre-register, you would need to go online. The site, the address is there on the screen if you have it. You can also go to the Southwest Georgia Public Health website online where we will have this address posted. It is very important to pre-register because if you do, things will just go a lot smoother and a lot quicker for you. If you show up at this site without pre-registration, it's just going to take you a lot more time. The location will be at the fairgrounds on Westover and Oak Ridge. The turnaround time will be about 48 hours. There will be no cost. You will be asked to share your insurance information if you have insurance, but still there will be no cost to you. If you have a viable insurance, the company will bill the insurance and only expect what the insurance company pays. So don't be anxious if you're asked to share your insurance information. There will still be no out-of-pocket cost for the patient. If you don't have insurance, it's still free. So you'll be seeing more about this in the newspaper and on the media and in social media. It starts next Friday. Up until that time, we will continue to do our customary testing at the health department. I mentioned something earlier about trying to hire more people, and that's very important to us. We are challenged now to do all of the testing that we want and to do all the vaccinations that we want because we simply need more staff. And so this is where a lot of folks in the community could help. If you want to be a part of the solution, we are actively seeking nurses, RNs, LPNs, and also what we call healthcare workers. Healthcare workers do not need to have any training. We're looking for high school graduates or beyond to help us with such things as answering phone calls, making appointments, helping with the testing process, and with data entry. So if you go to the Southwest Georgia Public Health .org website, you'll see there are links and buttons there. If you're interested in these positions, just click on it and that will get the application process started. The more people we have to help us, the quicker we can get this done. We also would welcome volunteers, medical personnel who might be retired or who might be active now and just have some extra time to spare, or a non-medical person. And again, if you go to that same website, southwestgeorgiapublichealth.org, we have a link there for people who want to volunteer their time. So we're working hard to take care of the community. We're trying to do it quicker, trying to do it better. That's our goal, and that's what we will do. In the meantime, please do what you can to take care of yourself and your family and your community. Thank you.
Thank you so much, Dr. Ruiz, for your remarks today. We will now hear from an update from our coroner, Mr. Michael Fowler. Mr. Coroner.
To God be the glory. To God be the glory. To God be the glory. Thank God. I know you see me with the suit on. This is where we're going back to now. I don't have the virus, so don't think I have the virus because I have this suit on. The virus has picked up in our community tremendously. First of all, I want to acknowledge this is Dr. Martin Luther King's birthday. I don't want to let that go past me. But I thank God that I don't have the virus. But I have friends that have had the virus. I have friends that have the virus right now. And I have friends that have died. I have family members that have had the virus. I have family members that have the virus right now. And I've had family members to die. I have had colleagues had the virus. I've had colleagues right now have the virus, and I've had colleagues to die. I've had pastors and members of churches that had the virus. There's pastors and ministers and members now that have the virus, and I've had pastors and members to die. I've had classmates that had the virus. I've had classmates that have the virus right now, and I've had classmates to die. I want to say, as everyone have got up and spoken, this virus is taken back off similar to like it was in March. We cannot lighten up. We cannot lighten up. And I want to encourage you, if you're having a gathering, whether it's I know Christmas and the New Year's, we're getting that surge right now. As the mayor said, the next 3 weeks is going to be very crucial. If you have a gathering, whether it's a club, family get-together, sports event, or even a church event, church service, we cannot lighten up. We got to follow the CDC guidelines. We cannot change from what we was doing. If you having a gathering, the building must be sanitized. You got to spray it down. You got to sanitize it. You got to check temperatures as people are coming into your facility or club or gathering or games, sports events. You got to sanitize hands. You got to practice social distancing, and you got to mask up. This started working. We've been preaching this since March of last year, and we preaching the same old song. Many times you don't see members or people are not wearing masks as they should. If you don't practice these social distancing, you will have a super spreader from your event that you're having. That's why I say you can't take your feet off the pedal right now. There was a story, a man was sitting at his house caught on fire. The grandkid was outside playing. They ran inside and said, "Grandpa, the house on fire." Grandpa kept sitting there. The neighbor ran in trying to get Grandpa out. "Grandpa, the house on fire." Next thing, the fire truck came up with the fire hose and the fire extinguisher coming in the house. Then Grandpa believed. That's when he believed. So what I'm trying to say, we've been preaching this since March. Do what we need to do. Don't let the hearse back up to your resident, then you believe. You must believe now because this thing is serious. As of today, we have 224 confirmed residents here in Dougherty County that have died. I remember when we started off, and I was hoping that we never get to 50 back in April. Then we got to 100. Now we at 200. Now we're pushing toward 300. I hope we don't make 300, but it look like we're heading that way. 224 deaths. Residents in 31721, we have 33 deaths over there. 31707, we have 43 deaths. In the southwest side, 31701, we have 93 deaths. 31705 on the east side, we have 54 deaths. These are the breakdown of the race. We have 54 whites. We have 1 Latino, 1 Asian. We have 1 unknown. We have 166 black deaths. We have you see the total there. We have 118 female. We have 105 male. This thing is serious. I'm trying to get you to understand that we got to do something. If we don't do nothing, the number will reach 300. We have 86 black females. 86. And it's scary. We have 80 black males, 1 Asian female, 2 Latino males, 31 white females, and 23 white males. Age breakdown, we have 1 over 100. We have 22 in the age of 90. In the age of 80, we have 50. In the age of 70, we have 55. In the age of 60, we have 60. In the age of 50, we have 16. Age of 40, we have 12. Age of 30, we have 5. And the age of 20, we have 2. This was the breakdown back in March. We had 39 in March, 86 in April. May, we had 26. June, we had 6. July, we had 12. Then we picked up in August from probably 4th of July to 15. September, we dropped down to 6. October, we dropped down to 6. November, we dropped all the way down to 4. Probably after the holidays in December, it jumped up to 12. Right now in January, we have 11 already. And we still counting. We still have some cases. We still waiting on the results to come in. I want to encourage you. There has been a surge, like I said, since Christmas and New Year's Day. I would like to encourage you to follow the CDC guideline. Get the vaccine if you have the opportunity, the time to get it. I have gotten the vaccine. I have no soreness. I had no problem from it. And I want to encourage family members, friends, if you have the virus, many people have the virus and they still are going about their daily occupation, trying to do. They're still shopping. They're still going out, getting around. You need to quarantine because you are going to infect many other individuals. Again, I'm saying, let's follow the CDC guideline. I do not want to reach 300. We need your help. We're singing the same song, but let us not keep singing the same song. We have changed the curve back in the early part of the year. We can do it again. Let's get these numbers back down. I know the medical profession are tired. EMS are tired. The police are tired. I'm tired. But sooner or later, as I said earlier, don't be like the grandpa sitting in the house and the hearse have to back up to your house. I want to say, mask up. It's going to be one of the keys. Mask up. Thank you.
Thank you, Ms. Coroner, for your comments today. We'll pause now for any questions from the media. Okay. I want to thank all of you for being with us today. Valuable information given to our community today. We'll ask you to join us next week as we begin, again, as a reminder, begin weekly press conferences. We'll be here at 10 on Friday. That concludes our press conference for the day. Thank you.